Hello, everyone. My name is Afia Fraser, and this is my professional portfolio for the nursing capstone class for the BSN program at Polk State College. So within my professional portfolio, I will be going over these items listed in the table of contents: my resume, the reflective paper, the PDSA project, the advocate observation report, the IHI NIH certificates, and the 5-year professional plan. First and foremost, we'll start with my resume. I have only been in the clinical setting since
Alert from
January
Google
of
Chrome.
2018.
I drop news.
I have went into the clinical setting because where I want to further my nursing career requires I have had some more clinical experience. Previous to working in the hospital setting, I was working for a pharmacy benefit manager, doing telephonic nursing as well as prior authorizations for clinical review of medications. So this was a new forefront for me, being in a hospital setting, but it's been very rewarding and eye-opening since starting there. So going down my resume, I've also done some home health per diem at times. And the only certifications I have right now are my BLS, of course, my RN licensure, and eventually I would like to get certified in medical surgical nursing. And if I do pursue case management, then also would require certification in that as well. I do, of course, have my Polk State ADN education listed here, as well as my BSN with my anticipated graduation date of August of this year. Moving forward, in my portfolio is my final reflective paper. And all I have to say in regards to my BSN journey, my nursing journey in general, it's been difficult. There's been many obstacles that have come through this journey. And my father always told me that a setback is a setup for a comeback. And I've had to keep that replaying in my mind many times throughout this journey, getting my ADN and now my BSN. Being a single parent, working full time, going to school full time. There have been many days I've cried and said, I don't know if I'm cut out for this or not, but I just tried to remain resilient, kept my faith at the forefront, and here I am. It's a daunting process at times. This was a second career for me, so I'm a little bit older than most nursing school graduates. So a little bit of a learning curve for me, but I got through, and it has been an eye-opening and one of the most rewarding experiences I've ever had in my life, besides having my daughter. I learned, about the nursing theories and how you can bridge that with your nursing practice, how to expand my communication and speaking with physicians and other disciplines, just learning how to implement a plan of care for a patient. All that was exemplified or demonstrated more having my BSN and learning how that all comes together, especially using evidence-based practice. So it's been an eye opener. I know ADN was I guess the foundation, but the BSN has definitely extended that kind of knowledge that we've gained being in this program. The next piece in my portfolio is the PDSA project. So my project basically entails looking at the use of smart pumps with IV medication administration. And the facility that I was doing my volunteer service hours at was running into an issue where some nurses were having issues in regards to their scan rates. These are computed every month. And the baseline of having good scan rates when it comes to scanning the IV medications and the smart pump is 75%. And there are a couple nurses who were falling below that baseline. In the 60s and the 50s, it was consistent. And I took that as a task to see what were the barriers, what were they having issues with, why were they not scanning the medications, if they were scanning the medication. Was it a technology issue? Was it a learning curve issue? Was it because this was a change into the process of using these smart pumps, which have the barcode to kind of scan the medication and the barcode to compute the medication? Basically, it's a patient safety issue. Was there issues with that? And so I collected data, looking at the previous 2 months of April and May, and trying to focus on who was having issues with their scan rates. Speaking with the education nurse that I was shadowing, and we looked at the process of what it takes in scanning the medications, of using that smart pump, how it computes to enter into the medication administration record. All of those factors went into it. And looking at my literature review, looking at articles, by far, none of those articles relate that there is an issue with the technology. It was always looking down or leading to the nursing practice, or how that nurse was kind of scanning those medications along with that smart pump. And what the literature found was that many nurses were using workarounds. They were bypassing the process completely, or manually entering the medication dosages. They were not following the process in hanging the med and priming them at one point in time before they were to administer the drug. There were many issues that were with regards to process than technology. Now, sometimes there may be some technological related issues with the smart pumps, but more so than not, it was because of that nursing standard process. So I focused on 1 or 2 nurses who were having issues with the scanning process, looked at what their scores were, looked at what the process entailed of scanning the meds and using the smart pump, observed them doing the whole process, cycles of that, and then going back with the education nurse and reviewing their process and finding out specifically what their barriers were, giving them a questionnaire, which is here, asking them what did they feel their barriers were, did they feel they got enough training, if they were having any issues, did they make management aware, education aware of what was going on. And we came to a conclusion, more so than not, it was their process. They were not scanning the med, they were not using that process how it was outlined for them to prepare the medication for it to be primed and be hung, and then scanning the pump. And then when all that is done, there's a green circle that's in the computer system that says, okay, you can administer the medication. They were not doing that. So that's where their process was. And it was very little minute things that they were not aware of that, became the issue and why they were having these low scanning rates. So after having education there with these nurses, spot checking them, and just tweaking to see what they could do better with their process, one nurse who was in the 50s went up to over 87% in her next month. She was in the 50s for April and May, and in June she went to 87%. And that was just, speaking with them, finding out what they were having, what issues they were having in regards to that scanning process, and then tweaking that and making sure they're aware of how important it is that they do scan them for the patient's safety, for them and for the patients, and how everything can be computed in the system. A caveat to that is that if these nurses were continually having issues with scanning at low rates, they would have to go to a remedial class. So my takeaway from that is that, more so than not, before it becomes a continual issue, is to have the education specialists come and spot check the nurses, or have management come and spot check them to see where they may be lagging or what issues they may be having in regards to that process, because it may be very minute. It may not be something very large, and then they can, go about getting better with that process. The next piece in my portfolio is the advocacy observation report. Basically, I went to a hospital nurse practice council meeting at my facility with the learning specialist on my unit, and we just I got to see the other side of what a shared governance meeting is about. So basically, there were staff from each of the units, nursing staff from each of the units, along with nurse executives and other disciplines there, and basically going over any nursing issues, changes that want to be implemented. And if there were changes to be implemented, there was a vote to say yay or nay. This hospital is working on their magnet journey. So a lot of things are being discussed on how we get in, make into that process to eventually, applying for magnet status. The next piece in my portfolio were the IHI certificates. So the Q101 certificate. We have the Q103, which was testing and measuring changes with PDS cycles, which was very informative to help with the PDSA project, as well as Q105 was another project which talks about quality improvement. So if you're going to implement something and you want to have a benchmark, you want to see the results from that project, and that basically talked about that. And then the other certificate was the NIH project, but basically protecting human research participants. So making sure that whoever you're speaking with, you're making sure that they are aware of you doing this project, they're comfortable with the questions you're going to ask, you're not exploiting them, and whatever results you obtain, they're aware and they're kept anonymous. Their identity is not, put out there. Last and not least was my 5-year professional plan, of course, to continue my education, to get my master's. I want to eventually start it in 2019 after a break. I've been going to school for so long. I'm tired. I'm really tired. I'm burnt out. I just need a break before I want to regroup and start again back in 2019. I don't want to prolong it because, the more you prolong it, it gets harder to get back in. So that's one of my goals. I also want to, at my facility, probably get into some more council meetings. I want to be on a committee for diabetes. Really, the more I know about it, the more I feel it's something beneficial that would help with my knowledge in regards to care of a lot of patients that I deal with that have diabetes. And also continue to go to my unit practice council meetings, but also the hospital nurse practice council meetings. I think it's very beneficial to see outside of your bedside practice what's going on with nursing. I also, as I mentioned before, want to get certified in medical surgical nursing. And if I do want to go into care management or case management, what I essentially would like to do, that is a requirement as well. And also ACLS. I want to also get certified with that. I eventually want to leave bedside nursing. I don't want to necessarily stay in that forever. Nursing gives you so many avenues, and I want to pursue those and see what's open to me. I've kind of toggled with family nurse practitioner as well. I don't know if I'm going to land there or not, but that's also an option that I'm looking at within the next 5 years, God willing. But I just, I can't believe we're here. We're at the end. It seemed like it would never come. It came very quickly. And again, it's been one of the most rewarding experiences I've ever had. It has opened my eyes to my nursing profession and to what nursing is about. It's so much more than just giving medications and, making sure that patients are comfortable. It's so much more than that. And I'm so excited about what the future will bring and the avenues I will go down in my path in my nursing career. So thank you again to everyone. Good luck to everyone, and take care. Thank you.